Good morning. Thank you for joining us. This is the Equity Advisory Committee on Aging and Disability, or EACAD, EACAD, EACAD. You will hear that a lot today. Today is March 12th, and we are almost on time. This meeting runs from about 10 a.m. to noon. Again, thank you so much. Let's move to the next slide. Good morning. I am Carol DeAndres. I am the Master Plan for Aging, or MPA, Stakeholder Engagement Manager here at the California Department of Aging, or CDA, and we welcome you to this virtual space. Next slide. So just a few logistics before we start the meeting, and we want to welcome you to the first meeting of EACAD for 2026. So we are very excited. We have a lot of new members. We have a packed agenda, so thank you for joining us. As you can see, we have American Sign Language, and we do thank our ASL interpreters for being with us today and working with us. We're pleased to provide that. We have closed captioning available to you. So if you, to initiate that, on the bottom of your Zoom toolbar, you should have a CC icon. And if you don't, because Zoom likes to update, check under that More button, Show Captions, and then View Full Transcript. That should be available to you. Next slide. So following this meeting, we will be posting our meeting materials and the recording to this meeting under the Cal HHS, or California Health and Human Service Agency webpage under EACAD. Give us a week or so to get those up to you. And committee members, we have a lot of new members. If you look at your link, it is displayed as EACAD member and guest. If you could please right-click on that and change it to your name and your organization if you'd like, so we know who has joined us. And please, for our members, if you could turn on your camera while the meeting is in session, we know that you're with us. Thank you in advance for your help there. Next slide. So virtual meeting operations, the chat function is enabled for committee members, California Department of Aging staff, other guests to share out meeting-related resources and information. And for those of you that will be sharing out information to our participants, please note there is a drop-down menu and it says Share for Everyone. So please pay attention to that if you're sharing out information. The public is able to view this information. The chat feature and the question and answer function are not enabled, but we do have a public comment period, and we would welcome your public comments during that time. Of course, at any time, you can submit your written comments to our Engage email box. It is Engage, ENGAGE, at aging.ca.gov. Anytime, please send us your written comments. Next slide. Just logistics for the public comment period. If you're attending by phone, you can press *9. That will indicate to us that you have a comment. If you are on the Zoom webinar function, you have a raised hand icon. So please use that, and we will unmute your line. Note that we have a time limit of 2 minutes for each comment, so we appreciate your keeping that in consideration when you're giving your comment. And of course, at any time, please send your written comments to Engage, ENGAGE, at aging.ca.gov. The committee purpose. The purpose of the Equity Advisory Committee on Aging and Disability, or EACAD, EACAD, is to serve as a strategic partner to California's Master Plan for Aging, MPA, advising and ensuring that equity is intentionally and meaningfully woven throughout the implementation of the MPA's 5 bold goals. And we couldn't do this purpose, if we go to the next slide, without our EACAD members. We have some long-standing members here, and we are pleased to welcome new members that this is their first meeting. We have a number of them and they will be welcomed. If we go to the next slide, we'll see their names. And another page, please. As you can see, we have many new members. We're so excited to welcome you and to work with you. And we will have a more formal welcome in just a moment. But thank you again for coming. And at this point, I would like to turn it over to Yia to go over the agenda. And welcome. Can we go back to the agenda real quickly? Yia will go over the agenda and then we will welcome Lynn. So go ahead, Yia. Thank you.
All right, thank you, Carol. Hi, everyone. My name is Yia Zong. I am the Equity Specialist here at the California Department of Aging. Our agenda today is as follows. We will continue with the land acknowledgement, followed by opening remarks. We will then dive into setting the context for this committee with member engagement. At 10:40, we will have a guest presentation on migration, caregiving, and dementia study. Next, we will have the Aging and Disability Lived Experience Advisory Board update, followed by the Master Plan for Aging, the midpoint evaluation, and committee discussions. Then we'll dive into the last discussion with members regarding areas of focus for the committee, and then we'll open up for public comments and then adjourn the meeting at noon. So next, I'd like to introduce Lynn Fritz, who is an EACAD member, to provide us with a land acknowledgement before we start the meeting. So Lynn is an enrolled tribe descendant of the Karuk tribe, the Happy Camp in California, and then she also has lineage with the Hoopa people. So welcome, Lynn.
Thank you much. I invite us all just to sit back for a moment in your chair, feet on the ground if possible. We would normally stand, but it doesn't work for Zoom. So I invite you, if you're comfortable, to close your eyes. And together we're going to take in a long, slow, deep breath. With that exhale, I want you to imagine yourself someplace in nature, the place where the original people lived. And to recognize that the land that we honor today and the people that we honor today, we see the land as a living being. We have a relationship to all that exists. And so as we come together in this meeting, we recognize the diversity of people, the diversity of communities throughout the state of California. And wherever we are, this land was the home place of the original people, the native people, the indigenous people. And we pause, reflecting upon their history, the relationship each one has to the land, to each other, and to the communities as they are today. That we are all relations. We're all connected to each other. No matter what tribe or community we come from, we are one people. And so as we pause and recognize this energy, this concept, this thought, we move throughout this meeting with the same sacred connection to the energy of life, the beauty of all that is, and work collaboratively, supporting one another. Another deep breath in. Relaxing exhale. And even though you're bringing yourself from that space and nature, you carry it with you throughout this day, throughout this lifetime, and throughout this meeting. So I close this saying, aho, thank you. And I invite you to open your eyes and come back. Thank you.
Thank you so much, Lynn, for that wonderful and very special land acknowledgement. It's wonderful to have you here as a member, and we appreciate your thoughtful remarks on behalf of our tribes in California. So I'm so pleased to be here. I'm Sarah Steenhausen. I'm Deputy Director of the Division of Policy Research and Engagement at the Department of Aging. I'm so happy to be here and to introduce all of our new members today. Our director, Susan DeMorris, is unable to be here because we have a hearing in the legislature today on the budget, so we had to be there. But she wanted to just acknowledge how pleased we are with so many applications coming into this committee and amazing new members that we will all be meeting today. We have advocates and caregivers of older adult immigrants and refugees, individuals from the LGBTQIA, older adult and people with disabilities population, supporters and caregivers of older adults living with HIV, as well as tribal members and supporters and caregivers of our Native elders. I also wanted to take this moment to introduce Jax Kelly, who is founder and president, CEO of the Aging and HIV Institute and a longstanding Equity Advisory Committee on Aging and Disabilities member. Jax has been asked by our director, Susan DeMorris, to serve as stakeholder co-chair while she is the state co-chair of this committee. Jax has been an incredible leader on this committee. He has helped us stand up the Aging and Disability Lived Experience Advisory Board and has also been very instrumental in helping us find our focus and really make this a meaningful committee. So we're really, really pleased to have Jax in this role, and so appreciate our past and current members as well. I'm also really pleased to acknowledge that our Department of Aging has a new Tribal Affairs Manager. His name is Dalton Brown, and we look forward to having you meet him in the future. Finally, I wanted to acknowledge our MPA annual report that was released, our 5th annual report that was released earlier this year. Some of the highlights, we were really proud in 2025 to establish the Aging and Disability Lived Experience Advisory Board that you'll be hearing about today, which we call ADLIB. As well as California's first statewide survey studying the health, well-being, and service needs of older LGBTQIA Californians, which also included qualitative data through focus groups that were convened after the study's release. So in our chat, you will see a link to the 5th annual MPA annual report. I'm really pleased to now turn it to Yia Zhang, who will introduce our next agenda item, and hopefully we have the opportunity to hear from each of you as we set the context and discuss member engagement. Thank you, Yia.
All right, thank you, Sarah. So for this next agenda item, I invite all members to engage in a discussion to understand the committee's structure and focus. So over the past few years, we have met with members to provide feedback on the structure and focus areas for this committee, which include 1, the priority populations, and then 2, the Aging and Disability Lived Experience Advisory Board, the ADLIB. And then for the priority populations, we want members to provide insight and recommendations that center the experiences and needs of the older adult immigrants and refugees, the LGBTQIA plus older adults and people with disabilities. I'll also provide a link in momentarily to the LGBTQIA plus study. We also want to focus on older adults living with HIV, our tribal communities and Native elders. And then all this is, connecting back to the committee's purpose of serving as a strategic partner to the California's Master Plan for Aging, so the MPA, ensuring that equity is at the forefront of the implementation. Secondly, AdLib is where we invite members to serve as liaisons, communicate learnings and elevate issues that arise in the AdLib discussions to the other MPA stakeholder advisory committees. And then also to provide input to the development of AdLib media agendas. We do have a separate subcommittee for AdLib. And so now I'd like to turn it to Jax, our committee chair, to share his experience and then also facilitate a small discussion on this piece. So go ahead, Jax.
Great. Thank you, Yia. And thank you to Susan DeMorris and Sarah Steenhausen and the California Department of Aging team for the trust and confidence you've placed in me in this new role as co-chair. It's been an honor to serve on this committee alongside colleagues such as Denny Chan, Vincent Crisostomo, and Ephraim Gadhan, whose leadership and insight have been especially impactful in shaping the work of the Aging and Disability Lived Experience Advisory Board. I've learned a great deal from each of them, and I look forward to continuing that work together. By way of brief introduction, my perspective begins with lived experience. I'm a Black, gay, cisgender man over the age of 60, living with HIV since 2006. I'm also married to an 80-year-old man, which means that the realities of aging are not abstract in our household. They are present every day. My husband and I live in Palm Springs, where I also serve on the Riverside County Advisory Council on Aging and participate in the Inland Empire Master Plan for Aging Equity Action Committee. In addition, I lead two nonprofit organizations. One is the Aging and HIV Institute, which I founded in 2024 to focus on the intersection of aging policy and HIV. The other is Let's Kick Ass Palm Springs, AIDS Survivor Syndrome, a community organization founded in 2015, which I've led since 2019. Our work there focuses on addressing loneliness and isolation among HIV long-term survivors and witnesses to the AIDS plague years. I share that background because it reflects something important about this committee. The Equity Advisory Committee on Aging and Disability exists at the intersection of lived experience and public policy. Our role is to help ensure that equity is not an abstract principle within the Master Plan for Aging, but something that is visible in the way systems actually function for people across California. The Master Plan for Aging is an ambitious framework, but its success depends on whether it reaches communities that have historically been invisible within aging systems. That includes immigrants and refugees, tribal communities, LGBTQ older adults, people living with disabilities, and people aging with HIV, among others. One of the strengths of this committee is that many of us are not only advocates or professionals, we are also part of the communities the master plan is intended to serve. That means lived experience is not anecdotal. It is a form of policy insight. It tells us where systems work, where they break down, and where barriers persist that data alone may not reveal. I also want to recognize and welcome the many new members who have been invited to serve on this committee. The diversity of experience represented here reflects the complexity of aging in California. I look forward to learning from each of you and to working together in a spirit of collaboration. As co-chair, my hope is that we continue to build a committee culture that is thoughtful, practical, and focused on impact. Our role is not only to identify gaps and inequities, but also to translate what we learn from communities into insights that strengthen the implementation of the Master Plan for Aging across the state. And ultimately, equity and aging policy will not be measured by the plans we write, but by whether people can actually reach and use the services those plans promise. I look forward to the conversation ahead and working with all of you. And with that, I turn the program back to our colleagues at the California Department of Aging. Thank you.
All right, thank you, Jax. So now I'd invite new and returning ECAD members. If you guys can introduce yourself, and then just have a conversation about your feelings, your thoughts about this being in the ECAD. So again, I'll turn it to new and returning members to hear from them. Good,
Hi,
Carly.
I go. Oh, sorry.
Hi, good morning. I'm so excited to be here. My name is Carly Stelzer. I am a new member of this committee. I work for the California Behavioral Health Association. We've had representation in the committee before, but I'm really excited to be here, and I'm very inspired by what you were just sharing, Jax, especially around, the breakdown between where policy starts and where implementation hits folks on the ground. Prior to working in the behavioral health policy space, I received my master's in public health, focusing on specific health policies that impact LGBTQ populations and individuals living with disability. I worked prior to that as a long-term care assistant and a community health nurse in Stockton, California, where I served a lot of immigrant populations, and particularly was one of the only nursing assistants in our facility that cared for trans individuals, which was a really unique experience and really inspired a lot of my policy and advocacy work after working in those spaces. So I really was so excited to hear the things that you were talking about, Jax, especially as it pertains to loneliness and isolation. A lot of my loved ones are people who have survived the HIV epidemic, and it's very exciting to watch them age and grow into their older adulthood. And also, I know it presents a lot of really unique challenges and areas where the state and policy can be more supportive. So just really, really excited and honored to be here with you all and lend a voice to some of these issues. So thank you.
Thank you, Carly. Lynn, you had your hand up?
Yes, I'm Lynn Fritz. I am a licensed marriage family therapist in private practice. I'm also an ordained minister, and I also am a media producer, and I do a weekly radio program. So I interface with diverse populations of people. And of course, I work with those in the aging population, of which I am also a member. And one of the central things as a Native American, I'm Karuk Hupa and Swedish, bicultural. So what I witness is federally recognized people have many more services than the non-federally recognized. And so I interface and communicate with them about programs to try to help support them, especially the aging ones, our elders. And no matter whether it's Native American or whatever culture it is, aging has many issues. And I try to provide them with information and resources so that they can have better services and better health. And I'm in Redding, California. Thank you.
Good morning.
Wonderful.
I'll go
Thank
next.
you.
My hand is raised.
Wonderful.
Thank you, Sarah. My name is Dr. Julie Bates, and I am the Assistant Director here at the Agency on Aging Area 4. That is the AAA serving 7 counties here in Northern California, Sacramento being one of them. In my spare time, I also teach at USC Diversity and Aging, and my entire education career has been around looking at the intersections of being an LGBTQ older adult and how LGBTQ older adults navigate the heteronormative culture to hopefully have a good gay old age. That's really the research area that I look at the most. But I've spent my entire career in service of older adults. Before retiring from AARP, I had the great good fortune to work with them to develop a strategy and a plan and a focused, intentional way to engage with LGBTQ older adults 50 plus. And when I saw this opportunity come across, I'm like, this is something I'm really excited about, because diversity is something that I'm really excited about. as someone who has multiple intersecting identities, just like we all do, the opportunity to stand in support of our older adults in California in this intentional way was really important to me. And so I'm really excited to join this wonderful group of people and to be able to assist the Department of Aging and the state of California in really looking at what's different about older adults. Because whether we like it or not, one's lived experience impacts their aging. And if we do not identify how one's lived experience is different, we cannot serve all of the people who are aging in our culture. And it's not just enough to look at the heteronormative culture and go, that's how everyone is going to age. We need to be looking at, of course, the socioeconomic background. We need to be looking at their gender identity. We need to be looking at all of the things that makes us up as people, as unique individuals who do share some lived experience and impact on our aging life. So I'm really excited to be here. Thank you for having me.
Great. Thank you so much, Julie. It's so wonderful to have you as well on this committee. You have a wealth of experience. And I'm so pleased to introduce Ron Spingarn. Ron, great to see you.
Hi, everybody. Can you hear me? Yeah. Well, this is my first meeting. I'm really happy to join all of you. I have been technically retired for a little bit more than a year. The last 8 years before that, I was caring for my mom, who passed away about a year ago, and some older friends in Sacramento, which is where I live. And spent almost 20 years for the state
We're having
policy,
a little glitch.
health coverage, access to care. Let me know if I'm back.
You're back. It's just a little glitchy. Thank you.
Okay. So I spent almost 2 decades working for the state of California in healthcare policy, a couple of years in the state legislature. And before that, I spent a decade working in HIV and AIDS care and prevention on the Central Coast in Santa Barbara, San Luis Obispo, and Ventura counties. And I'm just really happy to start dipping my toe back in the water of healthcare policy and working with all of you on a lot of these issues, which are very familiar to me.
Yeah. Thank you, Ron. You're going to be a wonderful addition, and we're so happy to have you. And Eric, I'm proud to have you here. If you could introduce yourself.
Yes, thank you. And I'm happy to be here. Good morning, everyone. My name is Eric Anthony Devizin. So I'm here representing the Community Action Partnership, which is CAP of Riverside County. So as a commissioner for the low income sector, CAP is kind of a social determinant of health and ensuring that we sort of focus on folks that are below poverty and that they age with dignity. My approach to this board, I think, is informed by my time as a fellow with Caring Across Generations. And that experience solidified my commitment to just kind of getting involved and being interested in care infrastructure. I think I'm just really curious about supporting both the care seeker and the caregiver. So this aligns with my current role as the co-chair of the IHSS Public Authority Advisory Committee here in Riverside County. And here is where I advocate for consumer-directed care that empowers our individuals, to stay in their homes longer and in their communities. Currently, I'm a doctor of public administration student at CBU, and my focus is on administrative chronic normativity. It's kind of weird for me to say, but it's interesting because I've heard the normativity quite a bit, I think from Jax and then the other speaker earlier. So that's very interesting. So I study how rigid policy timelines and one-size-fit-all administrative structures often create kind of like time tax for marginalized groups, particularly LGBTQ folks. So I'm specifically looking at how we can make the master plan for aging more inclusive of LGBTQ seniors and more aware, I should say. And think and lastly, I guess I would say I'm here to ensure that we just implement state goals using person-centered data lens. I think that's just really important. And I think this would account for the intersections of poverty, disability, and queer identity. So I look forward to just being here, going over policy with folk, and I'm in Riverside County. And yeah, thank you.
Wonderful. What a great background. Thank you so much, Eric. It's great to have you on the committee. Amina, welcome.
Thank you so much, Sarah. My name is Amina, and I am the director of the Health and Mental Health Program here in Orange County for the Cambodian Family Community Center. We're located in Santa Ana. We're 20 minutes away from Anaheim. Disneyland's right there. I'm here really excited to be a part of this group and excited to learn all the things that the California Department of Aging is doing. As mentioned, I am the director of the Cambodian family, which we serve majority immigrants and refugees specifically from Cambodia. So I will be hope to be their voice to bring the information back to the community members as they are aging. And I'm also a caregiver for quite some time before my mom and my parent passed away. So I am part of that sandwich generation where I was taking care of my parents and also taking care of my young child. Currently, I'm also a part of I am a commissioner for the Orange County Older Adult Advisory Committee. I've been on that commission for about 5 years. So again, I'm just kind of very excited to really learn about what is happening at the Department of Aging and bringing all this great information back to the committee as well in Orange County. Thank you.
Wonderful. And, thank you so much, Amina. Your perspective will be really valuable. And I think as much as you want to bring information back, we want to hear information from your community and their perspective and really help it inform the master plan for aging. And as we hear from all of you, I'm just amazed at the wealth of experience and the perspectives that you all bring. And so just be thinking about, what roles you might want to play in the master plan, or sorry, in this committee. Jax is going to be helping us think through that, and we're going to have some time towards the end of the meeting to start thinking through that. But this is one of the reasons we're excited about this group of people is because of your engagement. And the purpose is to be hearing from all of you to inform our understanding. And so just putting that at the top of mind as we think through how you might want to focus this committee's work. So with that, I'm happy to have Anne Choi introduce herself. Thank you, Anne.
Great, thank you. Hi, everyone. Yeah, I'm so excited to be here and join you all. I'm a new EACAD member. I'm currently with Chapman Consulting. Prior to that, for the last 8-9 years, I was with the Centers for Medicare and Medicaid Services. Most recently working on duals policy, so policies affecting people who have both Medicare and Medicaid coverage and trying to help the two programs work better together. I've also worked on some language access regulations at CMS. Throughout all of my work, I leveraged my experiences, one, navigating the healthcare and public assistance programs generally, and two, assisting family and friends who have additional barriers, particularly cultural and language barriers, navigate those systems as well. So yeah, I'm very excited to be here and to participate and learn from all you all. Thank you.
Wonderful. Thank you, Anne. We're also equally as happy to have you on this committee. And Dr. Sue L. Hesson, welcome, Sue. Dr. Sue.
Thank you. I'm also very happy to be part of this committee. I do come from a lived experience of a person with a disability. I have post-polio. And also was a caregiver for my parents before they passed away in 2021. And I come from speaking from the lens of a person with a disability caring for two aging parents, which was quite a challenge for me. They lived with me. also am a commissioner on public social services in LA County, where I co-chair. And currently, we're working on our strategic goals for the next 3 years. What else can I tell you about myself? I had served with the Department of Aging as part of the team with the SILC, the State Independent Living Council. And at the 90s, I know I'm aging myself, but we are Department of Aging, so. And so it's really, and at that time, they were really resistant in wanting to merge with the disability community. And which I found very interesting because as we age, whether able-bodied or disabled, you do need resources and assistance and accommodations and accessibility. So it was a very interesting transition when I was on there. Currently, I'm very interested in working on emergency preparedness, specifically for people with disabilities and seniors, not only because of what happened with the fires here in the LA County areas, and that the majority of those who died were disabled and seniors. So that's something that I'm including personally in our strategic goals for our commission, because I think it's something that we cannot ignore, and we're just one day away from an emergency. Nobody knows at that time. I'm currently working on a book called Silent Voices, which is a journey through spiritual, a journey of, see, I can't even talk, a spiritual journey through disability. And the reason I bring that up is that I incorporate a lot of not only lived experience, but also my work in the community and how our voices, specifically of people with disabilities, are often silenced. And I want to be the one voice of many voices that should not be silenced. So thank you.
Thank you so much, Dr. El-Hassan. What an important perspective. And I appreciate your bringing up this issue of the alignment of aging and disability. One thing that has been also central to the Master Plan for Aging is recognizing that aging is all of us. And it is so important to partner across our community of older adults and people with disabilities. And we're so proud that California has been leading the way on that since the launch of the Master Plan for Aging. And you're absolutely right. It has not always been that way. So having you engaged and others here who have, also experienced themselves or caring for others who are aging with a disability or into disability, it's a very important perspective. I do want to note, we are going to change the agenda up a little bit because we want to give more time to hear from all of you and to have a discussion on where you're kind of thinking of the work with this committee. So I'll give you an update on that after we hear from our next agenda item. So Alaya, Nikki, Diana, Candy, as well as, let's see, Linda Cardoza and Denny Chan, who's going to introduce himself. I think that's, and Danny Soto as well. We want to hear from you as well. So I think what we'll do is we're going to continue this conversation, which I love, after the next agenda item, because we've been so fortunate to be joined by our colleagues at UCSF in their work to launch the migration, caregiving, and dementia study. So we wanted to have time. This is such a timely study, and we wanted to have you all hear from them, from Dr. Alyssa Bernstein-Seidman, who's the project director from UC San Francisco, Dr. Tala Al-Rusin with UC San Diego, and Dr. Nama Rezon from UC Davis. They're going to present the information related to the study and have a Q&A session following the presentation. And again, older adult immigrants is one of our key focus areas of this committee. So we will pick up where we left off, and I just want to be respectful of the time of our colleagues from this who are representing this study. So I'll turn it over to you, Dr. Alyssa Bernstein-Seidman. Thank you.
Thank you so much. It is such an incredible honor to be invited to present to this group. I was reviewing the website and materials from the past and the list of advisors, and just am humbled by all of your experience, and I'm grateful to have this chance to share a project that we've been working on for about a year and a half now, and are looking for, insight and feedback, as well as hopefully ongoing engagement over the next few years, if possible. Next slide, please. So today we're going to be talking about our work, which is funded by the California Alzheimer's Disease Program Grant through the California Department of Public Health. And it's a consortium grant with UCSF, UC San Diego, and UC Davis. And we're looking at the intersection of migration, dementia, and caregiving. Next slide, please. So just quickly to introduce our project team, my name is Alyssa Seidman, and I'm a medical anthropologist and faculty in the Institute for Health Policy Studies at UCSF. And I'll ask my colleague, Dr. Nam Razone, to introduce herself.
Hi, everyone. Thank you so much for having us. Really a pleasure to be here, and thank you all for your work. I'm Naama Razone. I'm on faculty at UC Davis in the Department of Family and Community Medicine and the Division of Nephrology.
And our colleague, Dr. Tala Al-Rassan, was not able to make it today, but she's a family physician and also leads the Displacement and Health Research Center at UC San Diego. And then we have several other team members who aren't on this call today. Next slide, please. Just to thank our incredible research team who are on the ground doing field work and interviews as part of the study from across the 3 sites. Next slide, please. And I'm sorry, this is a click through. I didn't realize I wouldn't be moving the slides myself, but we just wanted to share some background on migration, dementia, and caregiving to kind of show you how we've been thinking about this intersection. So we know that over 25% of California's population are foreign-born, including those who voluntarily migrated or immigrants, and those who are refugees and asylum seekers or who are forcibly displaced. We also know that migration is a key social determinant of health, which shapes lifelong stress exposure, access to care, and social support. And in California and also across the United States, we know that the immigrant population is aging, and with that comes increased risk of chronic disease, including dementia. Next slide, please. So the facts are, quite startling. Migrants in the U.S. have a 70% greater likelihood of having dementia compared to U.S.-born older adults, and 199% greater likelihood of having undiagnosed dementia, which indicates a real lack of access to, healthcare and support services needed to get a diagnosis. There's a compounding impact of mental health, dementia, and migration. Dementia and migration together increase mental health challenges, reduce family and healthcare supports, and create barriers to diagnosis and care. And so these combined challenges make living with dementia and caregiving more difficult. In this population, that becomes even more difficult. So just to give a sense of where issues of trauma come up across the migration journey, and trauma is a risk factor for dementia. Pre-migration, people encounter lack of opportunity, exposure to war, poverty, and natural disasters. During travel and transit, there's challenging and life-threatening conditions and unforeseen costs. Post-migration, people experience lack of social network, potentially uncertain legal and financial status. And then even during integration and settlement, people may experience poor living conditions, unemployment, and assimilation difficulties. Next slide, please. So for our work, our overarching methodological approach to address and understand some of these key issues are to use a qualitative approach, which involves interviews where we learn about people's experiences, stories, and histories. And this really, I think the the person who spoke at the very beginning about making the connection between people's lived experiences and policy. This is really something we care about a lot, especially as anthropologists. We're really trying to understand people's, everyday experiences of being caregivers, of being immigrants and refugees, and of being kind of living with dementia and caregiving in dementia. And then based on what we learn, our aim is to inform policies and find better ways to improve people's lives and better support communities and service systems. And this is where reaching out to groups such as yours will make such a difference, because we don't want this work to just exist in an academic vacuum. We're really hoping to engage with communities, engage with advisory boards. We have our own community advisory board that's meeting across the course of the study. But we're out here to try to learn as much as we can. So the study aims are first to characterize the experiences, needs, and support used and desired among migrants with dementia and their family caregivers. And for this study, we focused on Latin America, the Middle East, and Afghanistan. That was a lot due to previous work some of us had done, as well as language capabilities on our team. We really felt it was important to be able to do these interviews in people's native languages rather than using interpreters. And so we hope, we know there are so many migrant communities across California, and hope that this is just the first step in this work, and that we'll be able to expand this work in the future. For our second aim, we're interviewing key informants from community organizations, long-term supports and services, and health services to learn about facilitators and barriers to providing care and support to people with dementia and caregivers who identify as migrants. So we've really been mapping the landscape of, different types of supports and services, and learning about what they need, what they're offering, where their gaps are, and what they understand about these populations. And then for our third aim, this is hopefully maybe where some of you could come in. We were hoping to interview policy leaders and community advocates and develop community-driven plans to better connect and tailor dementia support for migrants with dementia, and to inform health policies and practice change. Next slide, please. So we are, about almost 2 years into data collection now. We've interviewed 139 research participants. 77 of those are in the organizational health and policy category, and 62 are caregivers. And they're spread across California. We've been interviewing in Southern California, the San Francisco Bay Area, the Central Coast, the Central Valley in Sacramento, and Northern California. And, we've been interviewing in English, Spanish, and Arabic. Next slide. So I just wanted to give you a little taste of some of the, kind of data we're getting. We're, just jumping into our analysis, but we have looked at, some of the data in regards to, impact of kind of the compounding issues of mental health, caregiving, and dementia. So just to give you the voice of a caregiver who is an immigrant from Colombia and cares for her father with dementia, she said, "We fulfill so many roles, culturally, socially, humanly. We have to give back to our parents. But when you're caring for someone with dementia who has aggressive outbursts, it's very complicated. This is beautiful work, but it's also very heavy." And then from an interview with an organization leader that provides mental health services to the Latino community with a focus on older adults in Sacramento, this participant said, "It is prevention and intervention for those who are isolated, depressed, and have high anxiety. Just building a support system, getting them integrated into the community." So just a little taste. We have, a lot of data that we're working through. Next slide, please. And to kind of share some of the types of organizations we've interviewed in, we do have full lists that, we'd be happy to share as well, if that would be of interest. We've, interviewed people from ethnic community-based organizations, legal and medical legal services, caregiver support organizations, dementia-specific, Alzheimer's Association focused services, religious organizations, health and mental health services, general senior services, organizations focused specifically on refugees and immigrants, and then looking at both rural and urban-based service settings. And then we've just started work, engaging with federal, state, and county services, and we've looked at senior and aging services and healthcare services, and be interested to hear about who else we should be speaking with. Um, so I wanted to share some very early lessons learned just to kind of before we go into discussion. Many of these may not be surprising for those of you who are in this space, but we, wanted to kind of just put out what has been coming up as the most important areas of need. We've been finding the need to build awareness about dementia and its legal and clinical implications for migrant communities. So, we see a lot of, there's maybe understanding of what dementia means generally for older adults, but what does this actually mean for people who are dealing with trauma or a lot of movement, border crossings in their lives? And how can people who work in dementia or in legal supports for migrants understand this kind of intersection better? And also clinicians, have a real need to understand that intersection better as well. We've seen, many fragmented health, aging, dementia, and immigration service sectors, and really see the need for more cross-system coordination when addressing the needs of migrants. Figuring out how to build bridges or connections or create, directories where they could easily find each other, or, a toolkit that could potentially give more information about what's out there, in these different sectors, and connect them with each other. We've heard from caregivers and from organizational workers about profound experiences of discrimination, invisibility, and exclusion. There's, a real theme around the invisibility of this population, and, both in the data, not having enough data, not knowing where people are, not, having the numbers, but also, just in feeling invisible in this, services that are available, and service providers not knowing where to look to support this population. Next slide, please. And then there are, of course, substantial unmet community needs, and this is a real laundry list around, language barriers are huge in what we've seen, not having access to resources in adequate language, the need for whole person integrated care that integrates mental health services and health services. A lot more support is needed for caregiver well-being. Then, health and education practice that is culturally salient and migration aware, need for more social connection, need for more legal support that's dementia aware, support and systems navigation, and then a real need for community-driven grassroots engagement and support. Next slide, please. So, in our work, our goal is, of course, to develop actionable deliverables with a community advisory board made up of members from organizations that we've interviewed, and caregivers as well. We're thinking about policy briefs and memos, a statewide community resource directory, toolkits and roadmaps. Our community advisory board had an idea about forming an advocacy coalition, and then we've been making community presentations over the last year and a half in the community. Whenever we're asked to share about the study, we have a presentation that provides some education about dementia, about caregiving, and about the intersection. And it's been a real way to connect with organizations through these presentations. So some way to kind of formalize that approach to kind of continuing engagement. Next slide. And maybe I'll pause and just see if Nama wants to add anything before we get into our discussion. We've moved through these slides.
No, I mean, I'm really most eager to kind of get feedback from all of you and hear where this resonates with you. What are the things that we should be focusing on and really thinking about our next steps? And so thank you again for having us.
And so just some discussion points that we put out here, but we're open to really anything this group has to share with us or say or comment on, any critiques as well. But as we think about deliverables, what would make our work and findings most actionable for you, or those who would be impacted by this? Where could we have the greatest impact within current state initiatives? What questions should we be asking now or asking of our data to ensure that this is useful to state policy and the master plan for aging? And then what are the biggest gaps and opportunities in how California serves older adults who are immigrants across aging and disability systems? Next slide. So we'd love to hear and learn from you. We have a study phone number and email address. I'll put my email address in the chat as well. We're just so grateful for the opportunity to talk to you about this. And the final slide, I think, is just our acknowledgements. Thank you.
Great. Looks like we have a question from Dr. Sue El Hassan or a comment, and any other members. I saw also a comment in the chat and a question from Eric, if you want to raise your hand as well. And then we'll hear from Diana and Denny and Nikki as well. So, Dr. Sue.
Yes, thank you so much. I really appreciate the presentation. And just a little bit, I'm Lebanese, so I have the Middle Eastern background. I speak Arabic. And I know when I cared for my parents, my question is, first part is, are you defining dementia as under Alzheimer's, or are you separating it? Or because I hear so many times, sometimes it's included under that umbrella. So I
Yeah.
just wanted to find out how you were defining dementia.
Great question. So because we know people don't have access to diagnosis and the need, healthcare at times, we decided to make the definition more expansive. So people with memory or thinking concerns, people who have been diagnosed with dementia, people have Alzheimer's, so we know that a lot of people may, be living with some kind of dementia or even Alzheimer's, but not have been able to get a diagnosis. And so we didn't want to exclude people for that reason. So we've been looking across the spectrum, sort of from memory loss to Alzheimer's and other dementias if they come up.
I see. Okay. And then my other question really had to do with the cultural aspect. You mentioned culture, but I didn't really hear how you're really addressing it with certain groups. I'm sorry.
Oh, go ahead, please.
Well, I was thinking, I was brainstorming as you were talking, is like connecting with groups such as, I know in Anaheim, it's called Little Arabia, and there's a group called Access, and she just basically deals with immigrants coming from the Middle East. And I just wondering, like, that's an example I give you of an organization, and how are you connecting with that to help people understand their cultural perspectives, not only in aging, but also identifying caregivers that would help from that perspective.
Yeah, it's such an important, comment about culture. And we, a subgroup of organizational workers we've interviewed are from ethnic community-based organizations. So organizations that really focus on, different ethnic groups, or specifically on, people who are refugees from, Syria or Iraq or different parts of the Middle East, for example. And similarly in the Latino community, more, kind of focused on specific communities. And we're currently in our data looking at how culture is coming up, both from the perspective of caregivers and how, I think what we've heard so far and what we've read is, the ways that cultural misunderstandings or ways people think about illness in different ways, culturally, it makes a big difference. And there's often miscommunication between, how people are understanding illness and then what the kind of healthcare system understands, and people's needs that are more about kind of more holistic around social, cultural, and health needs kind of wrapped up together, and how they might not be getting that. And so I think we're seeing a real need to kind of educate the organizational side and the service sector on what do the cultural kind of needs look like in these different communities, knowing that there are many different cultures. There's not just one. But Nama, I don't know if you wanted to add anything to that.
I think it's such an important point, and I don't think that there's like one answer. I think, like you said, I think that's what's really been important about this project. There is so much both context that matters for how people navigate or don't navigate successfully this. And then also, I think one of the things that we've been looking at are what are specific to different kind of waves of migrants or waves of kind of communities. And then also, what are the things that are shared, and what are the things that we can actually learn across. And so that, I think those are the two things that we're thinking of right now.
Because many times, and I know from our community, aging and disability aren't perceived as positive. I want to say it that from that perspective. And so they're not going to know how to access resources because of that. So that's why I was like thinking, how can we reach these people? There's a high need, like you were saying, but sometimes the culture perspectives adds another layer of bias
Yeah.
that is not being addressed.
And we're also looking, at the very important issue of, assets and things that, are really strengths. We're, not only focusing on barriers, but there are a lot of, social and cultural strengths. I mean, people have been, through these experiences or have the cultural, structures even in it, even when displaced. And so we're hoping to kind of also identify those and build on those and make recommendations for how to sort of use people's social and cultural kind of backgrounds that and the things that work really well that might not exist in this kind of US or California medical or organizational context and see, I think there's learning to go both ways about needs and what works.
Absolutely. Thank you.
Great. Thank you, Dr. Alhassan. And you know what I think we'll do is, if it's okay with you, Alyssa, we will extend this for 5 extra minutes to 11:10 because we have several members that we want to hear from about their questions and comments on this. So I'm happy to turn it over to Nikki. Welcome, Nikki.
Thank you. Thank you, Elisa. Oh my gosh, my brain is so excited and I have so many tabs open on this topic. So, I'm a certified dementia practitioner. I didn't get a chance to do my intro as of yet. And July to December last year, I actually got a grant from Alzheimer's Association because I applied to do culturally responsive dementia care. And I'm in Antioch in the East Bay. And my focus, as the name suggests, culturally responsive was I'm an immigrant, I'm from Jamaica, but outside of that, I really wanted to target different demographics than what we traditionally hear about in the dementia space to include the LGBTQIA plus community, which I'm also a part of. And we struggled big time to get immigrants to join us. And we understand representation matter, but our ED, is Latina. Our board president is from Dubai, right? And so we felt like we had the right mix of people. Somehow the marketing strategies we were using just wasn't working out in our favor. So while we were able to grab enough where we could still lean into that culturally responsive care, as we're looking forward to continuing this grant with Alzheimer's Association, our question has been, how do we really reach the masses that need us? How do we reach the immigrants that just, for whatever reason, whether it was safety or culturally, I'm Jamaican, we don't ask for help and we don't accept help. And so I kind of knew that going into from some cultures that was going to be a challenge. So I'm so excited to work with you to kind of see how we can tap into the communities here that just didn't participate. And what it was, we were actually providing free respite to the family caregivers. So they got a break, right? And it was 4 hours weekly for 6 months. And it was just such a blessing to the families that did take part. But we know there's still a lot of work to do. We strategically chose communities that were low income, that had high immigrants. And in one city, Concord, we chose to work with the Rainbow Community Center, again, targeting our LGBTQIA plus community. And we just couldn't get enough folks to respond the way we wanted to. So hoping to connect and see how we can brainstorm getting some help on this side and probably give you some data as well that you'll hear more about when I do my intro in terms of my day job.
Amazing. Well, thank you so much. Yeah, recruitment has been a real challenge throughout the study. I mean, we're in extreme political times right now where that makes this very hard. But also, I think, it's hard when people are so burdened by what they're, dealing with in their everyday lives to have, even if respite is being offered, I think it can be hard to reach out. And yeah, we found, our teams have really gone into the community on the ground, visits, going door to door, making presentations, doing volunteer work, doing, charity walks and run, like any, we've kind of followed the lead of organizations that we've talked to about whatever they need. We're trying to, kind of offer that as, a way to connect and educate. And then, if they have then people that they can connect. I think, finding people that are trusted in the community, because we, are coming in from, as outsiders. And so, building trust and having the time to do that over the course of the study has been really important. And it's a real ongoing work in progress too. And I think, it's important as we think about the deliverables that we can't just assume we can drop things in, and we need to maintain those networks that so we'd be really happy to meet with you and share experiences and learn, because I think the more we can kind of connect and around this, the better.
Great. Well, Nikki, it's so great to hear from you and look forward to your introduction following as well. And I think all of this too just elevates how important it will be to take the findings from this work and apply it to, state policy. Very happy to hear from Denny Chan of Justice and Aging.
Hi, yeah, thanks, Sarah, and thank you so much for this presentation. I haven't had a chance to introduce myself, but I'll get to that later. In terms of questions, because I know we're tight on time, just kind of one was what something that you raised in your answer to the previous question, which is if you can talk at all or talk more about how the current federal policy making toward immigration has impacted your study, whether that's come up in the interviews that you're doing. You've discussed that it was harder to do recruitment in light of what's happening across the country. So that was one question I had. And then the second question I had was that, part of what you found confirms things that we know, right? The siloed delivery, people not knowing about services, adding all these barriers because of people's experiences and who they are. And the MPA is supposed to be an answer to that, right? It's supposed to be breaking down the silos in government. It's supposed to be a whole of government approach to how we build a better California for everyone to age in. And it strikes me that I'm assuming many of us would argue, insufficient services and resources for the communities that you're looking at. But those resources are out there, right? Like through the Older Americans Act, through other things, there's respite, et cetera, through the Medi-Cal program. What would be your policy recommendation as we implement the master plan on aging to ensure that the communities you're looking at and working with can be centered in that work and aren't forgotten about 10 years later when the MPA is over? Thank you.
Great questions, and big questions. I think first in terms of the federal, policy situation and its impact, we're in every interview we're asking how has the political situation impacted you or your work, depending if it's a caregiver or organization. So we're hoping to put something out that that looks at people's voices around that question and really get the answers from on the ground. But we've of course heard from that the numbers of people showing up to services has just dropped dramatically, of course. And from the legal organization side, just dealing with a lot of confusion and challenges. And so in the dementia space, they're already dealing with issues of like trying to keep people out of courts, and because it gets harder with capacity loss and things like that. And so now that people are dealing with all the other issues around legal status that come up, I think that's just gotten more challenging when you're dealing with capacity. And then another thing we've heard is caregiver who's been deported, and what do they do then? So there are a lot of like very nuanced legal things that I think are being impacted by the political situation, and then big issues around fear and access to services. And then major issues, a lot of organizations are losing funding or resources, and just having a huge impact on their ability to provide support, and when the needs are just growing in the community. So we are hoping to really get that report out as soon as possible. It's one of the first questions we're going to be kind of analyzing from the data, because I think this moment it's so important. In terms of the policy, what the recommendation would be, I I hesitate to like answer now when we're just starting our data analysis from the voice of people that we've interviewed, but um, I feel like there's, you know, maybe one of the things I've seen is one of the most successful things I've seen is the medical legal partnership, which allows people to have kind of almost that no wrong door model of like coming in for medical services and getting legal services, coming in for legal services and getting medical services. So thinking about resources more holistically, and then how do you add on the kind of the cultural piece to that and the social networks to that? So, there are examples of these bridges that exist, and I think kind of looking at those models that work really well and thinking about how to expand that beyond just the medical legal partnerships, but into other sectors. That is that issue of these silos, but I think there are these concrete examples of like the medical legal partnership that we've looked at like has very discrete ways that they help clinicians understand the legal issues and the legal folks understand the issues around dementia and capacity and caregiving. And so what does it look like to take that model and and build more kind of formal kind of partnership approaches, because what we're seeing in the data is a lot of people talking about referrals and their organizational networks and things like that. So a lot of this is happening in a very kind of informal way. And so how do you formalize those connections that people are making or build sort of or strengthen those networks? And so that's just one thing that comes to mind. But I think there, Nama, if you have any thoughts
No,
beyond.
I mean that those are the key questions. I mean, I think the co-locating services, I think, is a huge one. And really thinking, I think, in the innovative way around where should services be. I think that's one of the things that we're really finding, related also, for example, to the political climate. People might not be where we want them to be, or like think that it's the easiest way to connect with them. And so really kind of thinking about if the master plan on aging is going to be actually serving all of California and all of kind of the aging community, how do people actually feel like this is for them and actually serves their needs? And that means I think really working with trusted partners who have been doing this work for a long time and putting services where people are, rather than hoping that people kind of navigate these services because of all the barriers that some of you have brought up around feeling like this is not something that necessarily is talked about, or this is not kind of something that they know where to get services for. So I think a lot of it is also working with those key partners to really do those bridging work.
These
Yeah,
are, oh, I was just going to say, we're going to take a little more time. We want to make sure to hear from Diana, Danny, and Lynn on this as well. But I would also love if you're available to bring you all back after you're finished your study, because I think at that point, it will be really important to think about how to translate that into more actionable items, as has been discussed. And I think this is a perfect group for that. So anything else you wanted to say before I turn it over to Diana?
Well, I was just going to say that, there's this example of a mosque in the San Diego or El Cajon area where they provide, some, dementia supports. And even they were, brought someone in to help do kind of initial evaluations and cognitive evaluations. And I think that's like a good example of this sort of what Nama was saying, like co-locating and going where people, this is a space where people are using, regularly, socially. So.
Yeah, absolutely. Okay, so we will leave a little bit of time. Let's try and wrap this up in the next 3 or 4 minutes. So Diana, welcome. It's great to hear from you.
Thank you. Glad to be here. Just wanted to, I feel like your lessons learned related to building awareness, having a fragmented health, aging dementia system, and the experiences of discrimination, and then unmet community needs, right? The lack of services or need to improve them is right on point. And this topic is very near and dear to my heart. I had my father-in-law had 12 siblings. Of those 12, 10 died of dementia-related illnesses and issues. And they were all ag workers. They worked in the agricultural fields, outside in the fields and or inside packing sheds. And so I'm wondering if you addressed any rural agricultural type of issues or needs in these areas, because it sounds like your studies have been more like urban areas. So I'm just wondering if you expanded out to the rural areas and needs of people that work in the fields, packing sheds, make their living, and are generally impoverished, low income. So that's my question.
I'll let Naama answer that because her
I
team's
mean,
been
I'm
focused.
happy. I mean, thank you for bringing that up and also kind of for sharing your own experience with this. We find that often when we connect with caregivers or we connect with organizational, often there is kind of this very personal component of this. This is something that many people experience. So our team at UC Davis has been doing outreach both in Sacramento County, but then also all the way to the Oregon border and then all the way kind of through the Central Valley. And definitely we connect with a lot of rural communities. Many people are very, very eager to speak with us. And really, I think there's really a lack of services, often kind of zero neurologists, for example, in an entire county to connect to somebody. It's interesting that you bring up specifically the agricultural workers. We just had a meeting today actually thinking about this of the farm workers. I think there's also a lot of kind of these working assumptions around kind of this is kind of a younger community. And in reality, this is also an aging community. Like Californians are aging and also our farm workers are aging. And kind of how do we also think about that community caring for kind of the people who are actually doing this work? And so I think there's really a lack of research right now that's really thinking about exposures. There's kind of a lot of work thinking about kind of environmental exposures and cancer exposures, but also kind of linking it to neurological kind of impacts. And so I think this is very much an area that we're excited to learn more. It has, I will say, been really hard to connect directly to caregivers because they're juggling so much. So we'll connect with the organizations. We now have a number of connections in farm labor camps, but often we'll connect, for example, through schools. And so is that kind of the opportunity to connect to kind of that generation that then kind of connects you to older individuals. But we're very much open to kind of getting your feedback and thoughts of how to connect to the right community.
Great. Thank you. Wonderful conversation. Important issue to uplift about older farm workers. Danny, and then we're going to wrap it up.
All right, thank you so much. I'll keep my question fairly brief, I think. I was wondering if you have or if you have plans to look at any differences in addition to the similarities between those who have migrated kind of voluntarily versus those who've had refugee experiences. And I'm also just struck by the you know, increased risk for dementia and cognitive challenges, which is, opposite to like the immigrant paradox, where we see actually kind of better outcomes in some other areas. So I'm just, I guess a question and an observation, but I'll turn it over.
Yeah, we'll definitely be looking at the sort of group of participants who came here under forced migration and those who, immigrated for other reasons. And it ends up working out that I think, our UC San Diego colleagues have been focused kind of exclusively on the refugee and asylum seeking community, and it's been all from the Middle East and Afghanistan. So, Tala already had, a lot of work that she's been doing with that community for many years. And so, uh, and then the San Diego or the Davis and San Francisco research has been more focused on the immigrant population. So there will be kind of separate analyses, I think, both to look at what's similar and then, yeah, absolutely the, differences, that people are facing when they're, still living in, resettlement kind of spaces when they're, we've heard, people whose kind of main source of support and information are resettlement agencies, rather than people who've been here for longer and may have larger networks of support, but not always. So we've also heard of people still returning to their resettlement agency 20 years later as a source of support. So I think it'll be really interesting to see kind of both the differences and similarities, and then how issues of trauma, which come up in obviously in both groups, different and similar types of trauma, how that has shaped people's experiences and, looking at, the ways that they talk about trauma in relationship to the dementia kind of journey that they're going through in the caregiving journey. Because I think trauma kind of can, and, the mental health impacts of immigration can shape people's experiences, moving through a diagnosis in healthcare and in the caregiving space as well. And managing, transnational, family dynamics where people still have, relatives in the home country and may actually sometimes move back and forth across borders at times when it's been safer. And so we're looking at all of those different dynamics in the data through our analysis.
Well, this has been a fantastic conversation, and I want to thank you, Alyssa, for leading the conversation and for, of course, helping inform the understanding of this committee. So many important themes, awareness and reaching the communities that are often the most, underserved in our state, and thinking about how we can take some of the findings and really make them actionable, especially at this time when we're seeing so much fear and concern about for this population. So look forward to continuing the conversation, and thank you all for your engagement. I do want to note for members of the public, we will be having public comment towards the end of the meeting, so please stay online with any questions you have. At this point, I'm so happy to turn it back over to Jax. Jax, as well as Denny and Vince, Chrysostomo, and Ephraim have been so critical in helping to stand up our Aging and Disability Lived Experience Advisory Board. And I think our discussion, even through this meeting, shows the importance of taking lived experience and really helping inform policy and programs with the voices of those who use and are needing services. So with that, Jax is going to give an update on our Aging and Disability Lived Experience Advisory Board and some of the key themes we've been hearing. Jax, thank you.
Thanks, Sarah. I want to start with one simple idea I heard again and again in our first ad lib conversation. Access isn't just whether a service exists. Access is whether a person can reach it, understand it, and use it without being worn down by the system. One participant described the basic act of asking a question and getting help as an endurance test. Quote, "I've been sitting on the phone call for an hour just trying to get a hold of someone. And when the system pushes people to a portal or an app, they said it plainly. If you want to deal with it online, no, that's why I called." Another described being moved from prompt to prompt, department to department, and what they were really asking was simple. Can I talk to a person? That's not just a customer service problem. That's a systems design problem. And it's an equity problem. Because the people navigating these systems are often older adults, people with disabilities, caregivers, people already managing medical complexity, financial stress, or isolation. When access requires stamina, the system favors those who have the most margin. And transportation came up quickly. One participant put a real price tag on community participation. Quote, "To go to church is like $30, $60 round trip." Another described shared paratransit routes that loop past your own destination more than once before you finally arrive. Mobility isn't convenience. It determines whether someone remains socially connected, medically stable, and mentally well. Housing came through in two connected ways: stability and the ability to remain at home rather than being forced into institutional settings. We heard from someone living in subsidized housing for seniors and people with disabilities, housing that makes services possible. But we also heard from caregivers navigating medical systems while managing their own health crises. One described trying to coordinate cancer care, dementia care, and disability supports at the same time, encountering delay, redirection, and paperwork at every turn. Caregivers are holding up entire systems quietly, and when access fails them, the consequences cascade across families. And we heard something equally direct about what's at stake when supports aren't coordinated. Not all places have programs that allow people to stay at home, and that means people who could remain in their communities end up institutionalized. When home and community-based services break down, people don't just fall through cracks. They fall into more restrictive, more expensive, less person-centered settings. Fragmentation was another powerful theme. One participant described a clearinghouse organization that works beautifully in their county, and then said, "Not every county has an organization like this, and there's nothing available." Access should not depend on zip code. And one advocate put it bluntly, there are two types of people in the world: people with disabilities and people who are temporarily able-bodied. Aging guarantees that this conversation belongs to all of us. That's why the diversity of the applicant pool matters so much. In reviewing applications, we saw intersectionality everywhere. Older adults who are also caregivers, people with disabilities who are community leaders, LGBTQIA plus individuals on fixed incomes, multilingual applicants, people from rural, suburban, and urban communities. This wasn't a narrow slice of experience. It was California. And that diversity tells us something important. These access challenges are not isolated. They cut across geography, identity, income, and role. So what do we do next? First, we treat navigation as a core service. If someone must spend an hour on hold to get help, we have not delivered the service. A website is helpful, but human navigation capacity and warm handoffs are essential. Second, we align transportation policy with real life. Not every ride is medical, but every ride determines whether somebody remains connected to community. Third, we design housing, home-based services, and caregiver supports as an integrated ecosystem, not parallel silos that require heroic advocacy to survive. AdLib's value is not just storytelling, it is a pattern recognition grounded in lived experience. And if we are serious about equity in aging and disability policy, then the measure of our success will not be whether services exist on paper. It will be whether people can actually reach them without exhaustion, humiliation, or harm. And that is the standard the community is asking us to meet. And as I've been talking, thank you for sharing the pictures of the people who are our board members. I'll turn it back over to you, Sarah.
Great. Thank you, Jax. You have an incredible way of summarizing. We've had 3 meetings now and really elevating the key themes and the voices of those that we've had the fortune of getting to know through this lived experience advisory board. If you're interested in being part of the group that works with the lived experience advisory board, please let us know because we welcome your participation with them. We're really trying to get it so that we take the learnings from this advisory board, the lived experience advisory board, and inform our other stakeholder advisory committees as well as our state partners so that we can really uplift the voices of those that are most impacted by these issues and ensure that we're embedding them in the master plan for aging. And of course, this committee is a really critical role in helping facilitate that conversation. So please let us know. And I think at this point, it's a great, we've switched the agenda around because we want to use the remainder of the time to hear from those we haven't heard from, but also just to be thinking about next steps. I will let you know, I can tell you that in our other stakeholder advisory committees, we really encourage working partnerships between the meetings. So it's really up to the committee members. If there's issues that you all want to start working on, we encourage that because then what we hope is that the following meetings, we will hear from you with your recommendations or the key issues that you've identified. And, could be related to our 3 populations of focus or related kind of intersectional issues to that as well. And as I said, you also can play a role with the Lived Experience Advisory Board. So at this time, I'd love to turn it back over to those of you who we haven't heard from. I have your names all written down, so I will call on you if we don't hear from you. But if we want to start just with hands from those that would like to start by introducing themselves. And I see Candy is here. Welcome, Candy.
Hi, thank you so much. My name is Candy Bawa. I am a certified health education specialist, and I've started off being a community health worker, going out into the community talking about cancer prevention and education. And I had about 16 different counties that I would go and do this meaningful work in. And I would talk with migrant populations, LGBTQ plus, and unhoused individuals. So it was really great work to be able to address the social determinants of health and healthcare access, just because they live in a quote unquote rural and frontier area doesn't mean that they shouldn't have this information to make informed decisions. I also do have lived experience as being one of my grandmother's caretakers after her second stroke, and I do volunteer with Sutter Care at Home, where some of their enrollees are either veterans or suffer from dementia. So I think that my experience really aligns with the committee and its mission and purpose, and it's something that I'm truly passionate about. Thank you.
Thank you, Candy. I love your the experience that you bring and working as a community health educator. So thank you for being here. And Linda, welcome, our HICAP representative.
Thank you so much. Hopefully, my microphone is now working and you can hear me fine. For those of you, my name is Linda Cardoza, and I currently serve as the director of the Health Insurance Counseling and Advocacy Program in Orange County. So, in a nutshell, what we do is we help people navigate Medicare. And it's not just Medicare, it's all the other types of insurances that individuals may have, such as Medi-Cal. So, we do have a number of clients that are Medi-Medi. So even though we assist thousands of clients every year across all communities of people, all socioeconomic statuses, we still need to increase the breadth and depth of people we serve. So as I'm listening to all the individuals that are on this call, there are so many underserved communities that do not know of the services that are available. These are free services. It is a program of the CDA. And we need to be able to reach into these communities. So part of what I'm going to get out of this that's going to help us is to help us inform how to reach some of these communities. But it's not just the communities I've been hearing about today, but I also think about veterans. And I may have missed that if that came up earlier, because that is another community of people, older adults generally, that we need to be able to serve. But it's also one that we're seeing more of, and these are older adults that are solo agers. What can we do to assist individuals that are older adult orphans, those that no longer have family members that can assist them? So that is of interest. And I also have lived experience. I am an older adult. And I'm also bicultural, so that makes a difference. And I did serve as a caregiver for my mother, where English was not her first language. And witnessing firsthand what happens in the medical community as a person ages and they don't understand English fully. But not only that, it's the cultural aspect of it. In her case, it was Japanese, and it's the deference to medical providers. So having seen all of that and having and working in the field of helping people with Medicare, because we hear all the different kinds of stories, access to care, and then having the coverage for that care, that we want to be able to expand and be able to inform what we do by what we hear all of you are doing. But not only that, see what we can do and what we see out in the community with the various individuals that maybe will help inform this particular group. So I'm happy to be here, and thank you for having me.
Thank you. Such an important program and issue to consider in this discussion. So thank you. Diana, welcome.
Hello, everyone. So I'm Diana Jimenez. I work in Monterey County Department of Social Services. I'm the AAA director for PSA 32. I'm also the deputy director over Aging and Adult Services, which includes IHSS program, the Adult Protective Services program, and a few other programs under that, in addition to overseeing the CalWorks Employment Services programs. So I get to work with families with babies at the beginning of their life and with elders toward the end of their life. So at the professional level, so I'm very concerned about issues impacting families living in rural areas. They tend to be the most disenfranchised in my community, low income, agricultural is a big industry in Monterey County. And so we have lots of farm workers, lots of people that work in the fields. Of course, we also have lots of ag owners, right? And so we have what we call this curtain divide, lettuce curtain divide, where like some of you have heard of Carmel Valley and all these affluent neighborhoods, but we also have very impoverished areas in the county that don't have the resources that they need. So that's an area of interest of mine, and I think I can bring that perspective. In my personal life, I'm a mother of three sons. One who is a very strong advocate of gay rights. And so the LGBT community is very important to me, issues that impact that both on a personal level and a professional level. And I myself have also worked in the fields as a young child and young adult. And so even though on my dad's side, I'm seventh generation Texan, we were part of Texas in before 1840, before it was taken from us, and the border lines changed. So I carry that perspective and that experience with me so that I don't forget my roots and where I came from and the suffering of people who are still there doing the hard labor that most Americans or most people do not want to do. And especially those that are aging in that world, how difficult the difficulty they're having with their backs and their hands that no longer work for them the way they should because of the years bending down, picking strawberries, lettuce, and all those kinds of crops. So that's another perspective I bring. So I look forward to being part of this group and learning from all of you. And I'm excited to be part of you.
Thank you so much, Diana, and what an incredible background you bring, as well as lived experience. Nikki, welcome, and it's great to hear from you again.
Thank you. Hi again, everyone. So I'm Nikki Lopez. I'm in Antioch in the East Bay. I'm a certified dementia practitioner. I'm also a certified DEI practitioner. So I'm saying that to say I have the experience professionally and lived experience in quite a few areas here that we're working with. I was a caregiver to my grandma, who's now 99 years old. I'm now the informal caregiver. Um, and saying that there's something that I walk around with daily, and I just want to say it here before I get into the full spell, because Rosalind Carter said it best. There are only four kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. And I genuinely do believe by that. And that is the premise behind which we found I'm the founder and board chair for the nonprofit behind me, Caregiver One Call. We provide free 24/7 support to all family caregivers. So I know here we're focused on aging. However, this is from a parent navigating kids with special needs to complex medical issues all the way to seniors. And it's a telephone line that provides emotional support. It's range from asking someone to come off the ledge literally without that desperately, to giving advice, to answering and fielding questions about different types of treatment, dementia, etc. Additionally, we do recognize sometimes when we get calls, it's beyond our scope because we're not therapists. We provide emotional support. As a result of that, we have a partnership with BetterHelp that actually provides these callers with free mental health support as needed. We also provide training, virtual training, because caregivers just don't have the luxury of leaving to sit somewhere for the person that they're caring for. And again, it ranges from the very basic self-care 101 that caregivers never think about, all the way to navigating IEPs, advanced directives, just any and everything in between. And as I mentioned previously, we offer respite. However, that's when we have funding. So as we have funding, we'll give caregivers a break. And so far, we've only been able to do that with persons with dementia, Alzheimer's, because that grant was very specific. It was from Alzheimer's Association. So we're continuously looking for grants and applying and networking so we can give all caregivers a break, not just persons who are working with family members who have dementia, Alzheimer's. Additionally, I go to a lot of different senior communities, retirement communities, etc. And I know firsthand that lots of seniors in those communities are now back in the closet, right? For a number of reasons. There are no safe spaces. They don't trust caregivers. They don't trust the facilities they're in. So a big part of that for me, especially being a part of the community, is just really advocating and going out and making sure that our facilities have, create safe spaces. And it starts from, what do you even see when you walk in? What do you see in those brochures? Is there any indication that you're safe as a person of particular communities? So very big in doing the advocacy here in the East Bay, and looking forward to really working with all of you.
Great. Thank you so much, Nikki. It's wonderful to hear from you. And Alea, it's wonderful to meet you. I don't know if I mispronounced your name. Alea? Oh, we can't hear you. Uh-oh. Okay, why don't we see if we can help you with your audio? You want to try one more time? No. Do you want to try calling in? Maybe we can provide you the number to call in. And for now, I'll turn over to Danny, and then hopefully we can hear from you in a few minutes. Danny, and then Lauren and Denny. Danny, welcome.
Thank you. All right, I'll try to keep my intro brief. My background is in research. My PhD is in sociology, criminology. I looked at mostly in my work looking at disparities based on race and ethnicity, and also sexual orientation and sexual identity. And so I, in a lot of different areas, looked at disparities, among those communities and the intersections thereof. In my current role, I am the deputy director of a nonprofit here in San Francisco called Open House. We serve LGBTQ seniors and older adults. We do that through our senior center, which provides drop-in programming and support groups. So we also provide mental health supports as well. We also have a housing program that helps connect folks to housing resources throughout the Bay Area. You might have seen our monthly housing list that we provide for all of the 6 Bay Area counties. We maintain a housing list for folks. We also provide trainings mainly in San Francisco, but some in the larger Bay Area. We do dementia care for LGBTQ older adults, also cultural competence training, and also SOGI data collection training. And then we also have, we co-own and operate 2 buildings of affordable senior housing along with Mercy Housing, and we'll be starting construction on a 3rd building, hopefully early next year. So we work closely. We provide housing services and help folks build community to help try to alleviate some of the isolation and loneliness that can occur in older life as well. So it's always a pleasure to be here among such esteemed colleagues. Thank you.
Thank you, Danny. And we're so appreciative of the really valuable work at Open House. So I'm so glad to have you on the committee. Alaya, I'm going to try one more time. Hopefully you were able to call in. Do you want to try and unmute? Oh, yes, we can hear you. Okay.
I called in. Hi, how are you? It's Alea. Nice
Alea.
to meet everyone. I am happy to be here with you. I am excited to be on the board. I live with multiple sclerosis. I was diagnosed 16 years ago at the age of 18. So I am on the younger side, but I do see the manifestations of caregiving, aging with a chronic disease, especially a physical disability. And you really don't know. Everyone who lives with MS has a different experience. So I'm excited to be here and share my perspective. I have my master's in public policy with an emphasis in health policy from Pepperdine University, and I am currently in law school, in which I plan on becoming a disability rights attorney. So I'm happy to bring that knowledge and experience here, as well as I serve on the National MS Society. I'm on the Board of Trustees, as well as their Public Policy Advocacy Committee, in which I go back and forth to Washington, D.C. and Sacramento to lobby and advocate for individuals with chronic illnesses and disabilities, specifically multiple sclerosis. So thank you for having me here, and I'm excited to have this experience.
Well, we're excited to have you, and I think you might work with our friend Michelle Johnston, so please say hello to her if you know her.
I do. I
Good.
actually am going to have a meeting with her later on today, so I
Good.
will definitely tell her hello.
Please do. Please do. Great to have you. What a great experience and professional background you bring. Lauren,
Thank you.
welcome.
Thank you so much. I'm so excited to meet all of y'all. This is such a great alignment, I think, with the things that I'm doing as well. So I'm an assistant professor at the University of Southern California in the Leonard Davis School of Gerontology. My PhD is also in gerontology. I teach classes on sociology of aging, and I also do work on racism, stress, accelerated aging, and how that relates to both mental and physical health, especially for Black and Brown older adults. I also am a co-caregiving for my father who has dementia and am learning to navigate the services in Los Angeles County about how I'm getting support, but also how other Black and Brown people get support for dementia in this space. I'm a part of the support group Actively Caring Through Sharing, which has been life-changing for me and my mom in navigating this space. So, I'm looking for ways that USC specifically, but me and my work and my students' work can support the community of Black and Brown people in Los Angeles County. I'm also from the Inland Empire, so this space is, it expands a bit to the IE, but in general, this is my home, and I'm really happy to support our older adults here. Nice to meet you all.
Fantastic. And we will take you up on that offer about how you and your students can support these issues in this committee. So thank you for being here. Denny and then Ephraim, and we'll find a few others that we haven't heard from as well. Denny.
Great. Thanks, Sarah. I had a chance to ask a question earlier, but didn't get a chance to introduce myself. So I'm Denny Chan. I work at an organization called Justice in Aging. We're a national legal advocacy organization dedicated to using the power of law to fight senior poverty. I think I have been, he, him, his pronouns, I think I've been with this committee either since the beginning or close enough to the beginning, and I can't convey how excited I am that we have some new membership. It has been a very small and lean crew for a while, so I am really, really excited, and all the introductions that I've heard just give me a lot of hope and excitement and energy for the work that we can do in the future. Um, I also know we're supposed to do some thinking about issues and things that we can work on, and things that we want to see come out of this group. And I'll flag a couple of things that we are watching here at Justice and Aging and would love to hear from you all. If you're interested, you can always feel free to email me. I'll drop my email in the chat. But one is restrictions on coverage for older immigrants in the healthcare space. Obviously, there were a bunch that were passed as a result of HR1. And unfortunately, in Governor Newsom's proposed budget in January, he is proposing to eliminate state-funded Medicaid coverage. And that would, for certain types of immigrants, asylees, and refugees, leave them in this state without any source of coverage for their health care. And so that's an issue that we're watching. I'll drop a fact sheet that we have that's a California-specific fact sheet in the chat. And if you all are interested in working on that with us, would welcome the opportunity to partner. Similarly, as a result of the mess from the federal government, there's a significant chilling effect on older immigrants who are to access services. And I'll drop a KQED link that was talking about older people in San Francisco and other places in the state who now aren't going to senior centers, et cetera, and getting their meals. Would love to work on with you all on the chilling effect issue. And then one thing that we're watching in the LGBTQ space and HIV space is proposed changes to regulations under the Older Americans Act. We haven't quite seen them yet, but we want to be ready if and when they do drop. And so feel free to reach out if you'd like to partner on that as well. I'm not saying that's all we have to work on, but those are things I work on in my day-to-day, and would love to get your all's input and feedback and welcome it. So thank you. I'm so excited.
Thank you, Denny. And I have to say, we have been so grateful to you. You've been a longtime leader in this group and have really helped us kind of think about how to continue moving it forward. I would like to say we want to hear from Ephraim and also from Jose Montoya and Maria, if you're able to come on to the screen. And we're going to be asking who is interested in serving in a leadership role in this committee. We're going to be convening all of you in between meetings to try and kind of come up with the agendas and the areas of focus. We really see this as a working committee, and we want to spend our whole time at these meetings hearing from you and your recommendations, and that takes a lot of work in between from all of you. So appreciate those of you who have raised your hand thus far. Please feel free to do so. I have Nikki, Carly. I know Dr. Sue said she was interested in the ad lib. So anyone else, please let us know. Ephraim, welcome. Thank you for your service and leadership on this committee as well.
Yeah, of course. Thank you, Sarah. Hi everyone. My name is Ephraim. I think I was one of the newer folks on the last cohort that joined this committee. So it's really awesome to see a lot of new faces here. I also served with Denny, Vince, and Jax on the AdLib subcommittee, and I've been so inspired by them. I mean, they've been veterans of this work and this group. And so I am just regularly inspired and grateful to be able to work with them. Um, I've been a nurse now moving towards 12 or no, 13 years, maybe even longer, exclusively in long-term care. Even prior to that, I was a CNA and worked exclusively also in long-term care. So I've been working with older adults my entire adult career. I'm a couple years away from my 40th birthday and thinking about a world that I hope that I can age and live in with dignity and also die with dignity. And that's ultimately the shared goal of this work. I'm a first generation American. My family gained asylum in the States in 1989. And so I am more indignant than I've ever been in this work, just because of the attacks more than have ever been on equity and access of our shared communities. And so I'm really grateful to be here. I worked a number of years with Danny at Open House, which was the privilege of my life and my career world. I've left the career side of things and back to being a part-time nurse and an artist, and that's kind of where I get to really share my time. And yeah, so that's a little bit about me. So
Wonderful. Thank you so much. And I would love to hear from Jose. Are you able to unmute and introduce yourself? And then we're going to do one more announcement and then wrap up.
Hello, everybody. My name is Jose Montoya. I'm a senior director with the California House Collaborative, and we work a lot in rural areas. We have a program called MSSPE and multi senior services program. And for me, being in this in this space it's awesome because we are working on aging and finding solutions. I'm particularly really focused on the sustainability and policies on sustainability for aging, and that would, for me, I visualize that as policies that would allow for us to have sustainability plans that realign with financial backing to help our aging population. So definitely very interested in that. I'm also interested in the leadership. So definitely sign me up.
Okay.
So happy to be here. Thank you.
Thank you. We are signing folks up for our leadership group. Thank you so much. Lastly, Maria Aroke, would you like to introduce yourself? And then we're going to have public comment and we'll close out. I don't know if Maria is able to.
It doesn't appear that Maria's coming off mute.
Okay. Well, thank you for that. I haven't noted that we have Candy, Carly, Nikki, Amina, Jose, expressing, and Eric, this is wonderful, and Ephraim on the leadership group. So appreciate that. We'll be in touch very soon Yia will help us set up a meeting, and she'll be key in leading that, and just want to appreciate Yia's leadership on this committee. She's been incredible as our equity specialist. Danny, thank you. I love it. This is great. And we also know that Dr. Sue Alhassan will be helping out with AdLib. So with that, we have very important to let to hear from our members of the public. So I'm going to turn it over to our wonderful stakeholder engagement manager, Carol, to do our public comment.
Thank you, Sarah. We could put up the slide, Rosie. This is our public comment period. Thank you so much for our attendees that you're with us today. It's been a very dynamic and engaged conversation. And we'd like to hear from you. If you have a comment, joining by phone, *9, that will indicate to us. And then if you're joining by the webinar function, you have a raised hand icon on your toolbar, and feel free to use that. Anytime you would like, if you get off this webinar today and you have a comment that comes to you, please email it to us. It is engage@aging.ca.gov. And I see Eduardo has his hand up. Eduardo, go ahead. You can unmute. There you go.
Just want to say, first of all, thank you to everybody that put this forum together. I think it's very, very informational for all the nonprofits that are there to support obviously our seniors, our war veterans, and especially our homeless population that right now, a lot of the resources and services are put at risk. And then also, right now with, a lot of our unions being attacked and a lot of our unions representing agencies and obviously government agencies, it's good that we highlight the liability and putting, the liability that's putting patient care at risk, between patients that, have congenital disease, live with congenital disease and have a disability since birth. And obviously, there's a difference between the liability between personal injury and war veterans, and so right now that we're fighting hard for our healthcare, it's important that we, concentrate on caregiving and the resources needed for these families. So I just want to say thank you for all the support for our community. I'm a SEIU 2015 IHSS home care provider, and as well, I was a personal injury. I advocated for my mom for her caregiving services as a lien for her caregiving, working with workers' comp, fighting for her benefits through a work injury. So, there's different type of aspects on how families fight for their loved ones. And so I'm glad to see that I'm not alone in this, and there's a lot of us that are here to fight this fight. Thank you.
Great. Thank you, Eduardo. This is our public comment period. If you would like to give a public comment, please use your raised hand icon or *9 if you're appearing via phone. Give it a couple more beats. Anytime you wish to send a comment, you can do so via email to our Engage email box, engage, engage@aging.ca.gov, and we'll make sure to send that on to the committee. And I see it's been put in the chat as well. So thank you, Jackie. Sarah, I believe.
Great. Yeah. I'm going to turn it to Yia, but I also just want to say we will be following up by email on a couple of things for those of you who have expressed interest in serving in the leadership group committee, as well as our ad lib work group separately. We will be reaching out to you about, as well as we want you all to know about our MPA midpoint evaluation project that we are leading with collaborative consulting. So you'll hear more about that by email. We didn't have time for it today. But in the meantime, I'm going to turn it over to Yia for closing remarks.
All right, thank you, Sarah. And this has been a great
You've muted yourself.
Okay, well.
Yeah, can you unmute?
Hello?
Yes, there you go.
Okay, can you still hear me? Sorry. Yes? Yeah?
Yes.
Okay, sorry. So again, thank you everyone for the great discussions today. We will be reaching out in terms of the leadership group as well as the athlete group. Share any of the share any of the resources that we've shared throughout this presentation and webinar, as well as follow up with any other information that has come through through the chats. And I believe that's it. We do have our next meeting for set for June 25th from 10 to 12. We will also be in discussion about the meeting times, through this leadership group that we will be creating. So with that, thank you everyone, and we'll follow with the next steps. Thank you.
Thanks, Yia. Next slide. There we go. Please learn more about the MPA at mpa.aging.ca.gov, our Engage email, which Jackie put in the chat, engage, ENGAGE at aging.ca.gov. And of course, our CDA website, aging.ca.gov, and all our various social media platforms. Thank you all for being here today. We had such a great turnout. We're very pleased to meet you all, and we will see you June 25th, our next meeting. Or you'll hear from us in the interim. So again, have a great day, everyone. Thanks.